Well, welcome back to the Lance Wallnau Show. Today, by popular demand, we have someone who I really don't have to introduce to you because you know who Dr. Peter McCullough is. He's one of the most cited professional references that we have in the medical community, who early on risked his career and popularity in his industry in order to tell the truth about what he saw going on with the evasiveness of policy on protocols that could have mitigated and in many cases kept people from the whole COVID breakout. And so, Dr. McCullough, welcome back. You are our featured, one of our featured speakers at our health summit. I want you guys to know about this. We're doing a smart medicine, smart health hacking session with the brightest people that are in our movement on January 15th through 17th. If you want to come down to sunny Miami, we only got a few seats left at the Trump Doral, January 15th through 17th. But you can get tickets to view it live stream. We're going to do that for you because we have so many people who said, I can't make it, but can I watch it? Yeah, go to healthsummit.us, and you'll be able to get a front row seat to a very prestigious group of authorities on the medical field. Just want to get a quick update from you. We don't have enough information in our media world on the progress that we're making, and I think that sometimes we get overwhelmed with negative news, and we really got to focus and be celebratory about the progress we're making. What's your opinion of what RFK is doing at HHS? And has he made progress that we should be paying attention to and getting behind?
Yeah, I think RFK is very much a mixed review. Some people in the MAHA coalition want to see a lot more. Some are very satisfied. He has effectively gotten the government out of the business of messenger RNA vaccine development that was so dangerous with the Pfizer and Moderna vaccines. That's happened. And him and Trump, I think, is getting the government out of the transgender business. I think this is very important. A whole area of medicine that led to increases in psychiatric care and disfigurement and sterility and increased mortality. Lance, that the government is getting out of that line of support. But, these activities are still going on because there's private foundations and medical centers that are deep into some areas now that have caused far more harm than good.
Well, my question for you is with the latest, the food pyramid. I grew up with the food pyramid. I can't believe it. I mean, I actually thought that the dairy and milk and bread was, when I grew up, was part of what. Explain to me quickly, if you can, how the food pyramid got so convoluted and what's the new diagram look like?
Well, the old food pyramid, I think, was largely a product of various agricultural interests and lobbyists, and the Women, Infants, and Children program, the WIC program, which essentially offered, bread and cheese to pregnant women. The RFK and the administration is this is a step in the right direction, but they're far from acing the food pyramid. So, for instance, the evidence is overwhelming that dairy and fat that comes from red meat, that is dangerous. It promotes disease like cardiovascular disease, heart blockages, breast cancer, and other things. So the food pyramid, I would take that and I'd X out the red meat and the butter and the whole milk. And you can have those things occasionally, but diet really should be high-quality sources of protein. In this order: fish, beans, nuts, egg whites, non-fat dairy, and then occasional chicken and beef. And then, of course, fresh fruits and vegetables are unlimited. So, again, I gave it a B, and it could be much better. But, what RFK is not doing is not calling in the leadership from major academic medical centers around the United States and going through these issues. He's trying to do it alone, him and a small group of MAHA policy people, and that's just not the way to do things in medicine. We have 5,600 hospitals, 2,200 acute care hospitals. We've got 1 million doctors, 500,000 nurse practitioners and PAs. And Kennedy's got the authority to call in the leaders anytime he wants to in Washington based on CMS and NIH funding. He's not showing the strong leadership we need.
Wow. Well, that's the kind of analytics that our movement loves to hear, because that's 5,600 hospitals. And you're right. they're privately funded, and if people are into the transgender surgery at the children's whatever hospital, then the people are making money off of that, and he can't stop it. But we could shine a light on it. I think if people knew more, they'd probably speak up, wouldn't they?
I agree. And, in Texas, we've banned transgender under age 18. And the doctors in some medical centers are so delusional, they're violating the ban that Ken Paxton laid down. And now he has to sue them individually. So you can see something is wrong in the minds of doctors if they think that disfiguring hormones and medicines and puberty blockers and surgery that increases mortality, if they think that is something that should be done in children, as opposed to counseling and letting them go through natural puberty. And so I'm dead set against this transgender movement. I see it's all bad for our children, and we just need to abolish it nationwide.
Amen on that. Let me ask you about this is a rough subject to get into. I never know when you guys get in trouble. I ask questions that get people in trouble. So you edit your own response, and I can only ask the question. But my kids, I have grandchildren now, and my children have become so much more educated than I was about everything. They've almost become, and justifiably so, after COVID and all of the vaccine injury-related stories, and how the institutional support but was behind the pharmaceutical industry. And now there's a big question. My challenge is my children are skeptical about vaccines, but the vaccine schedule has somehow been revised. I saw Trump put out in Truth Social how it's been reduced from like 80-some jabs that your kids are going to get down to a smaller number. What can you tell us about the new vaccine schedule for my son-in-law, who's in the studio here, and my daughter, who's having a baby, and all my family members that are having babies now? They're so skeptical on vaccines that I don't want them to miss the vital ones. So what can you tell us about that?
Well, the whole world is becoming skeptical of vaccines, and the timeline is the McCullough Foundation issued a report that was grant-funded, independent, comprehensive on October 27th of 2025, and the title of it was The Determinants of Autism Spectrum Disorder. And we found that big bundles of vaccines given in combinations in susceptible children can trigger the development of autism, which becomes a permanent disability for the children. So, vaccines as a bundle, had that risk to it. Within 3 weeks, the CDC changed its language on the website, and we sent this to HHS and Robert F. Kennedy and everyone else. They're all on our feed. Then within 90 days, Trump bypasses RFK. He goes to Jim O'Neill, who's the acting CDC director, who's not a medical person, and tells O'Neill, trim the schedule. And then Trump tweets out, I did this. It's my call.
Oh, my gosh.
So, Trump pulled the ultimate boss move, and the vaccine schedule has been trimmed by 55 doses, 17 diseases down to 11. Now, the vaccines are all there, Lance, and doctors can give the vaccines depending on a child's risk, but it's not going to be one size fits all, and it's not going to be a huge battery of vaccines. And I think that's the right move. Remember, vaccines don't make children healthier than what they are at baseline. God creates children to have healthy immune systems. And now we have 12 studies in today's modern era of sanitation, nutrition, and hygiene, 12 studies showing completely unvaccinated kids are healthier than their vaccinated counterparts.
Oh, my gosh. See, you're feeding it. You're feeding it now. All of my kids are going to go, see, Dad, the unvaccinated kids are healthier. So I guess you're saying you really should do your decision based upon the health and susceptibility of the child, right, as to what vaccines they are eligible for and should look at.
Right. That's completely right. So, for instance, let's take one of the vaccines that was subtracted, the rotavirus vaccine, which is it's an oral vaccine. It's pretty innocuous. But let's say a child has malnutrition or what's called short gut syndrome, or another gastrointestinal problem. Well, that could be a child who could get really sick with rotavirus. They would need that vaccine. Or a child that has had their spleen removed, let's say for Hodgkin's disease. they should get the pneumococcal, Haemophilus influenza, and meningococcal vaccines. So I'm a doctor. I can decide who needs what vaccines. I don't need a government schedule to tell me what to do.
Very important. And by the way, that 2025 study, where would we go to see that?
Go to McCulloughFND.org, and you can download the entire paper. It's been published on the European Commission preprint server Zenodo and Open Air, and then it's undergoing peer review. We should hear back shortly on his final publication. But McCullough Foundation report, we think, influenced all of HHS, Trump, and the whole government apparatus, because it wasn't until our report that had the solid evidence did the government really make any moves. If they thought the vaccines needed trimming, they could have done this on day one, but they really waited for our report.
All right, so bring that graphic back up. We got a huge podcast audience. They're not looking at our smiling faces. Producer, bring back that last graphic. It was a picture of like the number of vaccines that are in the United States. There it is, 72 injections in the U.S. versus European countries, which has 11 injections. Is Europe ahead of us? Just out of curiosity, they're behind us in so many socialist trends, but are they ahead of us in this area? They banned transgender surgery in a couple of those countries nationally.
Right. So the UK has shut down their transgender clinics. In the Netherlands, they've realized it was a bad move. And, they didn't get to excessive vaccination as we did. And, our schedule looks a lot like Denmark. And I've been to Denmark in the last few years. I know the public health, key leaders there. And Denmark has better control over communicable diseases than the United States. So, and they give fewer vaccines. Well, how do they do it? Because, vaccines are only partially effective. One of the ways to manage disease is to treat it. So if you don't want to, have hospitalizations due to rotavirus, we've got to be able to give antidiarrheals and IV fluids to children, in clinics and urgent cares. And measles can be treated so people don't get very sick with measles. And we go on and on. So the bottom line is, vaccines are not the only method to control infectious diseases.
Do you know that
it's the entire delivery? And
you know what you started? My wife now has me doing a nasal spray with iodine and distilled water every day. I think she picked this up from you, but this stuff gets now every day. She hands it to me to go make sure I do it like I'm a kid, And so what's the story there with the iodine nasal spray that I'm doing?
Well, Lance, what happens is you come in contact with viruses. They begin to replicate in the nose, the front part of the nose, and you never feel it for about 7 days, and they amplify, and then they drains back to the throat. And their first sign, you have a sore throat. Then a few days later, you get explosive congestion and fever and everything else. You have 7 days to use a form of a nasal spray, and they all work, to knock down the virus, let your body's own immune system finish it off, so you never get clinically sick.
Come on,
this is
people.
a proven way to reduce colds, flu, influenza, RSV, COVID. It's way better than masks, way better than vaccines. Everybody should be doing it.
Look, folks, that one moment right there is huge. I want you all to go to healthsummit.us because people are sending in questions now. What are you going to be speaking about, Doctor, at the when we meet together for the Health Summit in Florida? What's your focus going to be?
I'm going to focus on these lessons learned coming out of the pandemic. We're now in the 6th year after the pandemic. Important things like nasal sprays, throat sprays, and gargles, the McCullough protocols, and they're copyrighted in my name for early treatment. And then importantly, spike detoxification. We've all picked up the spike protein from the virus, Lance. It's in our bodies. If you're taking the vaccine, you have a lot more spike protein in you. And what are the methods by which we get this out of our body and get back to health?
All right, so this goes into your wellness company, Kit. I want to promote it because you're on the cutting edge of this thing. So talked about the kit because now my staff has the kit here, and they're saying that when I travel, I should really have it with me. What is this?
Well, one of the innovations from the wellness company, Lance, is to have medications pre-prescribed. So you don't have to wait until you get sick and then wait for a doctor, then get a prescription and then wait for the pharmacy. By that time, you're too sick. So, we've innovated with pre-prescribed medications for common illnesses, dozens of them, and with a guidebook, and then telemedicine if you need it. So if you start to come down with a bronchitis and it's turning into pneumonia, you can treat it right away before you need the hospital. The same thing for a urinary tract infection that could turn into a kidney infection. And the list goes on and on. And so these medical kits, which are very affordable, people travel with them now. It's amazing how many times it comes up that you need them. Yeah, there you go.
I got it right here.
How many times this has happened to me? My wife got food poisoning or a bladder infection or a yeast infection, and you can avoid going to urgent cares. And you know what, Lance? This is really important for international travel. You don't want to be navigating someone else's health system. Get an emergency kit and have it with you.
I can remember growing up and going into the waiting room with all the sick people. They're all hacking. If I didn't have anything before I walked in, I knew I was exposed to something. And it was always the same thing. It was azithromycin. It was amoxicillin. I could have predicted what the doctor was going to do. So in a sense, you can be like, one of our docs is speaking, says, look, you guys have got to be so smart. In a sense, you've got to learn how to become your own family doctor so that you can have an intelligent conversation with your physician about what they're doing. But you've got like the codes right here, symptoms, what to look for. This is what the kids go to medical school for. But it's like the Pareto principle. 80% of the afflictions, 20% of the, 80% of the solutions are going to apply. So, This is a powerful kit, but where does ivermectin fit in this? Because you brought that up, and then Joe Rogan got slammed, but then we all came back to you and said, the doctor was right. What's the deal with ivermectin?
Well, ivermectin several years ago was actually part of a Nobel Prize award because it helped cure river blindness, this terrible disease in the tropics. And it turns out it's a very useful drug to treat viral infections like SARS-CoV-2. We found that to be the case clinically. I think it's probably the best drug to treat COVID. It's also used to treat various forms of parasitic infections. And now at the wellness company, ivermectin is in that kit that you have, Lance. But, people want to have a supply on hand. It's very safe. There are several states that have allowed it over the counter. However, nobody will carry it. So you go to the wellness company, you can order it, get high quality, high dose ivermectin, get it shipped right to your house.
Well, my staff is really follows you closely. I could tell when they're asking the questions and they want me to put it on a national show. For flu season, what home protocols combine with that new vaccine schedule option? Anything with the pyramids, immunity building, whole grains, for instance? I mean, they're combining things together. But for the flu season, what home protocols combine that are wise at this time?
Well, most important for the flu season, don't forget that's cold, flu, RSV, influenza, COVID, is to do that nasal spray twice a day. Now, if you've been exposed to somebody sick, go to 4 times a day. You go on an airplane, I guarantee somebody has it, Lance. When we get to Trump Doral this weekend, somebody is going to have something there, and there's going to be a lot of shaking hands and close contact. Bring your nasal spray. Be sure you do it in your hotel room, and you can get through these without getting sick. So nasal sprays and gargles are number one. Have an emergency medical kit. And for influenza, the drug we use is oseltamivir. It started on day 1. It's very effective. You wait to day 5, it's too late. Make sure that you have a good baseline immune-boosting vitamin and supplement approach. So, a once daily broad multivitamin, terrific wellness company. We have natural immunity that can boost the immune system with the additional ingredients. There's another one carried elsewhere called Immune Super Boost from Healthy Cell. I like to recommend that one as well. And the best thing about what's going to happen at the Trump Doral is that people are going to have a chance to have their questions and get answers and get into a conversation about this so we can all learn and get smarter.
Look, folks, remember, it's healthsummit.us, but bring up the kit. Bring up the lower third, guys. I just saw that we have a link for that. LanceWallnau.com/medical. And you use the name, my code name there, Lance, and you get 10% off the kit. This is for our staff. This is for me traveling. This is what we're doing right now. Because sure as anything, I'm on the road 150 days a year. You don't want to be out of the United States trying to look for an emergency room because you're coming down with something from a 17-hour flight on a plane. So that's where we're going to go. Trump, Doral, Miami. You get to talk to the doctor. We'll have Q&A. We've got a pretty modest group, about 150 people. So it's really going to be close. You're going to meet a lot of people like you. Make sure you get there. Any final thoughts, Doc?
Well, Lance, we had that kit with us last summer, and we were hiking in Glacier National Park up in Montana. My wife got food poisoning, and if we didn't have the Zofran in that kit, we would have been scrambling to an emergency room or urgent care outside the park. It would have been a mess. We were able to handle it with the emergency medical kit, that light blue kit. And with the discount code Lance, you're going to get that kit for under $200, which is a bargain to get all the medicines and everything you need to handle these problems. Remember, an urgent care visit, Lance, is over $1,000 nowadays.
Come on. We're helping you people. This is why it's smart. It's smart solutions for health. Doctor, we always love to see you. We're looking forward to seeing you in a couple of days. And tell everybody, come on down. We've made it so economic, people kick themselves if they don't find out about it till it's done. So make sure you get the live stream, healthsummit.us. Thank you, Doctor. Look forward to seeing you.
Thank you. See you there.